Topiramate Er is a medication that is used by itself or with other medications to prevent and control seizures, epilepsy. It is also used to prevent migraine headaches. This medication belongs to a class of drugs known as anticonvulsants. It is important to take this medication as prescribed by your doctor and to follow their instructions for the best results. The daily dosage and optimal timing for taking this medication will depend on your individual medical condition, so be sure to consult your doctor for the best guidance. Before you start taking Topiramate Er, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. You can swallow the whole capsule or sprinkle the contents on a teaspoonful of soft food like applesauce or yogurt. Make sure to swallow the drug/food mixture right away and do not crush or chew it. Drink some liquid after swallowing to ensure all of the drug is swallowed. To prevent kidney stones, drink plenty of fluids unless directed otherwise by your doctor. The dosage is based on your medical condition and response to treatment. For children, the dosage is also based on weight. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. Take this medication at the same time each day to get the most benefit from it and do not stop taking it without consulting your doctor. Tell your doctor if your condition does not improve or worsens. Some common side effects of Topiramate Er may include tiredness, drowsiness, dizziness, loss of coordination, tingling of the hands/feet, loss of appetite, changes in how foods taste, diarrhea, and weight loss. It may also cause mental problems such as confusion, slowed thinking, trouble concentrating or paying attention, nervousness, memory problems, or speech/language problems. However, many people using this medication do not have serious side effects. If you experience any serious side effects, such as bone pain, signs of kidney stones, unusual bleeding/bruising, rapid breathing, fast/slow/irregular heartbeat, or sudden vision changes, seek medical help immediately. Topiramate Er may also rarely cause a serious eye problem that can lead to permanent blindness, so it's important to get medical help right away if you experience sudden vision changes or eye pain/redness. In addition, this medication can rarely cause a serious metabolic problem, especially if you are also taking valproic acid. If you experience sudden/unexplained tiredness, vomiting, or mental changes, contact your doctor immediately. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. Remember that this is not a complete list of possible side effects, so if you experience any other effects not listed, contact your doctor or pharmacist. Before using Topiramate Er, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as your medical history. This includes conditions like glaucoma, kidney problems, liver problems, mental/mood problems, and metabolic imbalances. This medication may cause dizziness or drowsiness, so it's important to avoid activities that require alertness until you know how it affects you. It's also important to avoid alcohol and marijuana while taking Topiramate Er. Additionally, this drug may make you sweat less, which can increase the risk of heat stroke. It's important to stay hydrated and avoid overheating, especially in hot weather. Before having surgery, make sure to inform your doctor about all the medications and products you are using. For children and older adults, there may be increased sensitivity to the side effects of this medication. If you are pregnant or breastfeeding, it's important to discuss the use of this medication with your doctor to understand the potential risks and benefits. When taking Topiramate Er, it's important to be aware of any potential drug interactions. Some medications may change how Topiramate Er works or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. There are some specific interactions to be aware of, such as the medication orlistat. Additionally, Topiramate Er may decrease the effectiveness of hormonal birth control, such as pills, patches, or rings. It's important to discuss with your doctor or pharmacist if you should use additional reliable birth control methods while using this medication. It's also important to tell your doctor or pharmacist if you are taking other products that cause drowsiness, such as alcohol, marijuana, cannabis, antihistamines, drugs for sleep or anxiety, muscle relaxants, and opioid pain relievers. Be sure to check the labels on all your medicines, as they may contain ingredients that cause drowsiness, and ask your pharmacist about using those products safely. If someone has taken too much Topiramate Er and is experiencing serious symptoms such as passing out or difficulty breathing, it's important to call for emergency help right away. In the United States, you can contact your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe drowsiness and loss of consciousness. It is important not to share this medication with others. Additionally, while taking Topiramate Er, it is important to undergo lab and/or medical tests such as eye exams and bicarbonate blood level tests. It is essential to keep all medical and lab appointments to monitor the effects of the medication. If you forget to take a dose of Topiramate Er, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. If you've missed more than one dose, it's best to consult your doctor or pharmacist for advice. Make sure to store Topiramate Er in a tightly closed container at room temperature, away from light and moisture. Be sure to keep it out of the bathroom, and away from children and pets. When you no longer need the medication, make sure to properly discard it by consulting your pharmacist or local waste disposal company. Never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.